Let's talk about labor and delivery and some adjustments to parenting. So the different stages of labor. There are 3 different stages. The first one is when the mother is experiencing contractions, when the cervix is thinning out and opening up to 10 centimeters to allow for the baby's head to move through. So the second part is when the cervix has opened up and the baby starts moving into the vaginal canal. So this is the pushing stage. And then the third stage is after the baby is born and the mother has to push out the placenta. First stage is cervix, is all the contractions, getting the cervix to open up. The second part is the pushing, baby moving through the vagina. And the third part is afterwards, after the baby has been delivered and the placenta needs to be delivered. Different approaches to childbirth. There's natural. Some mothers prefer to get medication. A lot of different debate there. Most babies are born in the hospital, but about 1% are born at home. The key to a safe birth is having a trained healthcare professional assisting in the birth. Different complications can occur during birth. A prolapsed umbilical cord can result in hypoxia, which is the infant is deprived of oxygen. That can definitely be very scary. It can lead to intellectual disabilities if the brain is deprived of oxygen. It can cause death. Definitely a very scary thing, the prolapsed umbilical cord. Sometimes mothers need to have a C-section if the baby is in distress, if the baby's in an irregular position, or if the baby's too large to pass through the vaginal canal. Other complications, the baby being prematurely, so before the normal 37 to 42 weeks, so before 37 weeks, so before really the end of the 36th week would be considered premature. Being of low birth weight, so that's less than 5.5 pounds. So the average baby is around 7 pounds at birth and around 20 inches. That's the average. Something else I wanted to kind of touch on is adjusting to parenthood. So after a mom, after a dad, after they've experienced the birth of their baby, there's going to be different things happening, especially for the mother. She's going to be physically adjusting. Her body's going to be changing and adjusting to no longer, having the baby inside and rebounding from the birth process. But there can also be psychological changes. Postpartum depression is a concern for some women where they have a hard time adjusting to the hormone fluctuations, adjusting to the demands of being a new mother. Infant mortality is defined as the percentage of infants who die before their first birthday, who do not make it to their first birthday. So the U.S., we have a low infant mortality rate in comparison to undeveloped or underdeveloped nations. But we have a relatively high infant mortality rate for developed nations, for industrialized nations. The high rate in the U.S. is often a result of low birth weight babies. And so we also see a difference in infant mortality rates depending on the race of the mother. And I will put a link to a video that looks at that a bit.